Sometimes I'm asked, what is my one measure if I was only down to one indicator of a high quality health system? And I have a simple answer, which is, would the health minister agree to deliver her baby at a randomly chosen district hospital? All countries provide excellent care to some people some of the time. The rich and educated can find their way to the excellent clinic in any capital city. The quest should really be for high quality care for everyone, a consistent, reliable quality that can be counted on. If it's in the village or the city, the people are owed that. That is the basis of the social contract. That's a huge, huge load of mortality that should not be happening every year.
So there is this vast inequality. Think about how much of human capital a large population offers a country in terms of the economy, in terms of growth. And the way you invest in your people really is to invest in their health. As they say, health is wealth.
I do think quality is becoming more important. Many low-income countries face a much more complex disease pattern. High blood pressure, stroke, heart disease, requiring a greater focus on quality, on continuity of care and responsiveness. When we ask people about whether the system is working well as it is, we're finding that across all countries that about 3/4 of the population want to see major reforms or a complete overhaul. That just shows you that there is a building discontent with the current function of the health system. And that's why I think if we don't provide care at the minimum level of quality, then I think we're undermining the whole enterprise. A serious conversation needs to happen. How will we reduce wait times? How much more are we willing to pay so that we have more shifts of nurses so people don't have to be on call quite so long? That's going to have to be societal conversations. Really having an honest discussion with the population about what we're willing to spend on healthcare and what we're going to cut back on.
Nepal has a very diverse geography, more than 100 ethnic groups all over the country. The data shows is around 15 to 20% of Nepalese population have mental health and psychosocial issues. It's estimated at around 200 psychiatrists for 30 million people. Socioeconomic, political, livelihood, migration, natural disasters is happening every year. Because of all this, the need is quite high. After 2015 earthquake, more than 10,000 people died. So everybody were in stress. Most of the NGOs are in the post-earthquake context. They did not stay longer. And we understand all those grants were for disaster response. But when you talk about mental health, it's not same as some sort of infrastructure development project. This is something different. The mental health has to be supported for a long run.
TPO Nepal is researching and implementing low-cost tools to increase the availability of mental health care and psychosocial support to marginalized people.
One of the tools is one pager. Volunteers, because they know everybody in the community, identify mental health symptoms and refer them to the healthcare workers who are trained by our project. That was good, amazing, seems like it's really effective. We adopted the same tools in post-earthquake context. We adopted the same tool for a school-based program. So it could be used by the teachers. The same tool is now being adopted in other countries, like South Africa. We are working with gender-based violence survivors, we're working with torture survivors, we're working with refugee population to make the mental health services available and accessible, then has to think about this broad perspective.
There is a lot of skepticism around, is universal health coverage possible? Where the fear of universal health coverage dissipates is when you think about the cost of not having it, which is really the cost we're bearing now.
In my country, only about 15% of people have health insurance. Most of cost of treatment is out of pocket, catastrophic health expenditure. So what it means is that children starve. The next generation suffers because of lack of education, because of lack of nutrition. Healthcare system is definitely destroying health for 2 or 3 generations. It's as bad as that.
We need to be able to show that upon contact with the health system, people are getting better. We have to show that. If we can't show that, then we don't have a health system. We have some other system, but we don't have a health system.
Australia is, by world standards, is a very rich country with very high technology healthcare system. Unfortunately, the stories for First Nation women in Australia does not reflect how well resourced the Australian healthcare system is. A young woman might not have comprehensive primary healthcare services, might not have a midwife in their community, and they haven't done any precautionary scanning that mum and baby might need. English might be her second or third or even fifth language. Women might be entering a big institution. They've got a whole range of procedures that are happening to them that they're not being explained to clearly. It can be quite hostile and quite traumatic. And we know that often women will not engage in a system that they don't feel safe with. The state of things is quite alarming. You have to think, what kind of society will actually tolerate that? And then in the next breath, the opportunity before us is there waiting for us. Birthing on country is a cultural and clinical term ensuring that not only are the clinical needs met for mum, but also the cultural needs. One of the fundamental things about Aboriginal culture is connectedness. Everything is in relationship to something else.
The Birthing on Country project brought First Nation community groups and the City Hospital together to co-design services.
Within 3 years, we saw a reduction of preterm births by 38%. Those health gains have continued in the last 7 years. These are profound results, and we've never seen them happen in Australia. The word has got out. As soon as women were pregnant in the community, they were ringing up, how do I become part of this? My sister told me about this, I'm really excited. So I guess that's a real sign of acceptability in the community, to the point now a number of ladies use the system for their third baby.
We mustn't forget that the whole idea behind the health system is universal access. We are doing well for a significant portion of people, but there's a minority of people that have been completely displaced. So what are we going to do about them? Sometimes what we do is we stay in the safe side and we're breaking down the barriers from the safe side. Sometimes you need to go to the other side and break the barriers from there. Let's get out of the pharmacy now and go into the pub. We realized that for many of the patients in our community that we would like to really help, they're more likely to be the ones that have very little engagement with us around it. How does the healthcare system become better for them? This is the problem we come into sometimes to do blood pressure checks, literally 2 doors away from the pharmacy. We're going to invite people and we're going to have a chat with them around their blood pressure, but you never know where these conversations will take you. And when last did you check a blood pressure today?
5 years ago.
I haven't had it checked in 5 years. When we had that initial conversation about why we needed to go into the pub, there was a sense of, well, if I go into your environment, so I'm your guest, they know you're interested in them. You're not simply taking on the role. You will give them the same information, but they will be interested in it because you know what? They know you're interested in them. Sometimes, you have really poignant moments where there is people sharing their life stories. It's okay to talk about your health. We know that men, we tend to die earlier, and we don't do the screening and we don't do the follow-up test. We wait till things get really bad before we turn up. One of the stories that I always recall, this really disrupted blood pressure check where he was talking and cracking a joke that fades away after a while. And he simply told me, I said, I want to end my life because there's nothing to live for, is there? So thinking, I didn't see this coming. It's nice to have somebody listening. But I'm not just listening. I'm a healthcare professional. I can actually do something to help with all this. How do we let people know that you can access help? What's transformed it for us is what we bring back. The richness of people's perceptions of us, the NHS, health and well-being, the barriers, the needs that we need to address. We need to rebuild the social contracts. If we don't do it, the narrative doesn't change.
We're so much more connected than we ever were as a globe. People care deeply about health, so they share stories. And what we are seeing is expectations growing in every country.
Whether we call it universal health coverage or national health service, whatever we call it, I want people to feel that it is something owed to them by the government. Because you don't begin to make demands without a sense that you are owed the thing that you are demanding.
We need to work with the population, with patients, to say, hey, you've got to demand more.
A government is responsible for this. I want to figure out which government it is, and I want to go knock on their door. And I will keep doing that until they do it.
In this, our 200th year, we draw attention to universal health coverage as a critical issue impacting health globally. To drive change, we have two asks.